Welcome to What is the Difference Between a Medical Coder and a Medical Auditor. When a patient visits the doctor, the physician will document the diagnosis and treatments. The medical coder reviews each note and translates the documentation into medical codes. The medical biller will make sure all the necessary information is on the claim, including the medical codes determined by the coder. The biller submits the claim to the insurance carrier or government agency for payment. Then, hopefully, the biller receives payment for the claim. Now, upon payment, the biller will post the payments and handle denials. When the denial includes a coding reason, the coder will be consulted for assistance. Now we're going to look at what is a medical auditor. Medical auditing entails conducting internal or external reviews of coding accuracy, policies, and procedures to ensure you are running an efficient and hopefully liability-free operation. The first step for the medical auditor is to choose the focus of the audit. In general, the purpose of your audit should be to identify the clinical practices that are inconsistent or in need of improvement. The audit process should be specific, such as measurable data that is based on available records, important to the efficiency of your hospital and or your doctor's practice and the care of your patients. The second step for a medical auditor is to define the measurement criteria. After you've identified the focus of your medical records audit, determine the specific measurement criteria for the review. Then, conclude which factors will decide whether or not these criteria are met. Performing a literature review can help expedite the process, since using methods already proven to be successful eliminates the need to develop your own standards for measurement. Literature reviews can also provide benchmarks for comparison. The third step is for the medical auditor to determine which records to review. In order to choose which records to include in the audit, you must identify the precise patient population to be evaluated. Consider age, gender, clinical status, and treatment regimen, and be sure everyone involved in the audit knows exactly what determines whether a patient is included or excluded. The fourth step in medical auditing is to decide the sample size. Completing an audit of every chart which meets your inclusion criteria is usually not feasible, so a good rule of thumb is to choose approximately 10% of the eligible charts to review. Statistical significance is heavily impacted by the sample size. If not enough records are audited, the variables will be too numerous and the audit results will have limited application. The next step in medical auditing is to develop record-keeping tools. How you plan to collect and analyze the results of the audit will dictate the type of record-keeping tools you create. For example, will you record data electronically or with a paper-based system? The important thing is to organize the results in such a way that allows for evaluating individual records as well as aggregate data. Be deliberate about which data is recorded, as this affects the type of analyses you can perform and the future usability of your discoveries. The sixth step for a medical auditor is to gather the data. Coordinate the details of the audit, the date and time to be performed, the number of charts to be pulled, the individuals involved, and any other necessary information. Enlist the assistance of the medical records manager, if needed, to help procure the charts and ensure HIPAA compliance. Then, perform the audit and collect the data. The second to last step, so step number 7, of a medical auditor is to summarize their findings. This step is crucial since disorganized or irrelevant data can result in the ability to use the audit results to enact change. Reflect on how the findings will be used and summarize the data in the way which will be most impactful. And the last step for a medical auditor is to analyze the data and implement appropriate changes. Review the findings of the audit and identify the opportunities for improvement. For example, if you see certain patient comfort solutions, such as applying a topical anesthetic before minor procedures, being used inconsistently, you can add them to the standard protocol. You can also take advantage of existing benchmarks to help guide your decisions. Now, while auditing medical records may seem tedious, but the data contained within these charts can be extremely valuable to improving hospital efficiency as well as efficiency of your physician practice and ensuring patient satisfaction. It's important to use all of the resources at your disposal to provide the best possible experience for your patients.